let's dive into the future of baby steps for mobile health. Hemi is the creator of Fooducate. He is a foodie. I'm sure you'll learn more about food. How many people have used Fooducate? I know in my family, obsessive fans of this, and I'm really happy to have you on the stage. Please welcome Hemi.
Can you hear me? Thank you, BJ, and everyone for sticking around the hard hours. And thank you for giving me such a difficult topic. How can I predict the future of baby steps or the future of anything? Shameless plug before I begin. Download our app. It's free, iPhone and Android. You'll love it, and your kids will love it too. And maybe you'll eat a little healthier. Since I don't know about health in general, but I do know a lot about food, I'll focus my talk mostly about food-related health. Unfortunately, there's a big tie-in because obesity causes a lot of problems, diabetes, heart disease, stroke. So eating well is definitely correlated to better health. And the title of my presentation is Why Baby Steps Aren't Enough. And by this, what I mean is, despite individual a person's best efforts and the best baby steps that the graduates of today's program will design, America is probably still going to be struggling with weight, obesity, and disease related to that in 10, 20, and 30 years. And the reason is related to this picture. Can anyone tell me what's wrong with it? Exactly, it's a down escalator. So the problem that we have in this country is the obesogenic economy. There are too many environmental factors working against the individual despite his or her best baby steps. And I think the CEO of Weight Watchers said this morning, told us this morning the amazing numbers of how many people are overweight and obese in this country. So I'll ask a simple question. Why is dieting so hard? The answer is that it confronts a basic biological need that we have. We want to eat. And when we see food, we eat. And we see calories, we consume them. It's just the way we're wired. And that's why 80% of people who lose weight gain it back within 2 years. How many people here have been on a diet in their lives? And how many of you have gained the weight back? Okay, so you know what I'm talking about. That's why I would invest in Weight Watchers and Jenny Craig and all those other companies. I think they have a good recurring revenue model. But seriously, the message we tell ourselves, and maybe our doctor tells us, or a dietitian, and the government to some extent, is eat less. The problem is we get a much stronger signal from business. Okay, eat more, eat more. And we encounter it every day, everywhere, at all hours. And you can just think about today, all the food that's available to us to consume each time we walk out this room. There was breakfast, and there was post-breakfast, and there were snacks. And even though they were healthy, healthy snacks also have calories. Does anybody know how many calories they consumed since they got here this morning? There's one person. How many? Let me look it up. Well, good for you. But you see how difficult it is. And actually, from some research, people underestimate their calorie intake by at least 30%. So back to this obesogenic economy, just look at the numbers here. It's over $500 billion every year in business that stands to lose if we all eat healthfully and stop eating junk food. That's tens of millions of jobs. That's thousands of super smart CEOs. And practically all the politicians in Washington, D.C. that get lobbied to keep the status quo as it is. So I don't want to be depressing. The end of this presentation is going to be very optimistic. So hang on there. What's this graph? What are these numbers? Does anyone know? Exactly. And since 1980, the numbers have gone up. These 700 calories additional food are being seen on people's waistlines here in this country. And I'm going to show you some really irritating examples of this obesogenic economy. And the first one, I have 3 kids, so this one is particularly irritating to me, is the junk food marketing to our kids. And it's not relenting. And the FTC chairman, John Leibovitz, just a few weeks ago said that it's probably time to move on from trying to regulate junk food marketing to kids. The commission, and I quote, does not support legislation restricting food advertising to kids. Give me a break. Here's another interesting fact. 90% profit on junk food and drinks, but only 10% profit margin on veggies. What do you think people are what kind of business people are gonna go into if they're going into a creating a food company? Here's another interesting factoid. The USDA, celebrating 150 years this week, by the way, was signed into law by President Lincoln, had one task to take care of, which was promoting agriculture output in the US. And I think they've done a pretty good job. But now they're also responsible for healthy school lunches. So raising calories on one hand and lowering them on the other hand doesn't make sense. Okay, who knows what this is? Awesome. So it's a giant Twinkie. And who knows how many ingredients are in a single Twinkie? How many? Close, 37. Here they are. You can read them. And why does a Twinkie need so many ingredients? Shelf life. The longer the shelf life of these products, the shorter the shelf life of us humans. One more thing I'd like to talk about before the optimistic end to this presentation. Exercise. So there are 2 myths. The first one is perpetuated by the food industry. They're telling us that we're getting fatter because we're not exercising. We're not as physically active as we were 30 years ago. This is in fact a lie. It's not true. We're just as active as we were 30 years ago. And also kids. You may say, but my kid is playing video games all day long. He's never going outside. Well, when we were kids, we just watched TV and read comic books. So that's one myth. The other myth is basically the lie we tell ourselves. We wake up early in the morning, we work out for 10 minutes, half an hour, and we feel like we got a carte blanche to eat as much shit as we want all day long. And guys, it just doesn't work that way. Even just one can of soda pop, 150 calories, is all it takes to erase your positive balance from this morning's workout. You're going to need to walk for an entire hour or jog 2 miles to take care of that 150 calorie can. But during the day, you're probably going to have a bag of chips, a few chocolate chip cookies, and who knows what else. So keep that in mind. Now, having said all of this, there is hope. And I think a lot can come from the clever use of technology together with baby steps. And I'll give you a few examples of very, very large systems that have changed due to the combination of technology and baby steps. Who knows what this is? Egypt, Tahrir Square. So 10 guys with Facebook and Twitter accounts sitting in a few apartments in Cairo were able to topple a tyrant who'd been in power for over 30 years. And it started with baby steps on technology platforms. Who knows what this is? What the slang expression for this is? Pink slime. Yeah, this has been in the news. So even though the New York Times reported about pink slime about 3 years ago, the big story started 2 months ago when Bettina Siegel, a mom from Houston, didn't want this crap in her kid's school lunch. So she blogged about it, and she used a platform called change.org to petition online for the school district to take it out. This thing went viral in the blogosphere and later in the traditional media on ABC News, and supermarkets said they would not sell any ground beef with pink slime, and basically the factory is shut down. So just another example of how one person using technology was able to create a change. And I think the challenge for us is how can we harness technology and the collective baby steps of millions and billions of people to really create changes in large systems and around our society and the government. So the way I think about it is a lot of apps and services today are focused on baby steps for myself and maybe my community, my family, but we really need to focus on how can we build tools that empower communities and create change in society. And with this, I'll end. Thank you very much.
Next up, David's. Oh, Rajiv, are you next? Rajiv is the founder of ShapeUp. And Rajiv and I have crossed paths a few times, including at TED-Med, and we've always had really interesting discussions, and I've appreciated his kind of common sense approach to how to help wellness professionals improve the health of their workforce. Rajiv, you're up next. Please welcome Rajiv to the stage.
Thanks, BJ, and thanks for everybody for staying awake and energized through the end of the conference. I wanted to talk about, so BJ said this session is going to be about the future of baby steps in health innovation. I think the future is going to be, once BJ teaches all of us how to do baby steps and how to help our constituencies, our users do baby steps, we're going to want to figure out how to accelerate those baby steps. So that's a starting point, but I'm curious, how many people here consider themselves impatient, right? So I'm impatient too, and more importantly than that, my clients are impatient. And they say, great, baby steps are a wonderful place to start, but how are we gonna accelerate the pace of those baby steps? Because we don't want baby changes in our healthcare costs, we want giant changes in our healthcare costs. So how do we get those baby steps to be giant steps? And that's what I wanted to talk about today. BJ has his model which says that behavior change equals motivation times ability times a trigger. And what I'm interested in is how can we increase ability and how can we increase motivation? So the idea that BJ talks about is that baby steps naturally move up this curve, and behavior change grows naturally from baby steps to larger steps, and it's true. And the insight that I had when I was a medical student watching my patients and trying to help them lose weight was that once they got started on the baby steps, the people who really became successful did some things that were very natural to them. And as human beings, we're naturally social. And so those people did very basic social things like find an exercise partner and find a group of people to go on a diet with and bring their whole family into the baby steps behavior change process. And those were the people who succeeded and moved up the curve. And so I want to talk about how we've learned at ShapeUp how to use social mechanics, social approaches to accelerate baby steps. And this research has caught the interest of a lot of journals and societies where we presented it because not a lot of people have been looking and really studying the social influences on health, and it's a growing area of interest. And I heard someone earlier yesterday, I think it was Alexandra Drain, say that healthcare is really snobby. So instead of showing you these publications, I'll show you that these are the places that have been talking about this, and they've been covering the research that we've looked at. And I think if Cosmopolitan and Allure say that this is interesting and impactful, then it probably is. So hopefully you'll find it to be. So my first way that I want to tell you about how you can accelerate baby steps is by using trusted networks. And what I mean by that is getting people to work together with others whom they know and trust. I see the difference here as the difference between Facebook and MySpace. MySpace was an open social network where there was not a lot of trust, and so people joined and they used aliases. They didn't use their real name. They didn't share authentic information, and it turned out not to be thoroughly engaging. And we saw a lot of cases on the internet of like MySpace stalking. Facebook, however, was a trusted social network. They rolled out in colleges and universities, and you had to have a domain name specific to that environment in order to get in. There was a level of trust, and so people were willing to share authentic information about themselves. And that's what made it a very influential platform, and it made it grow exponentially. So when we talk about healthcare and what do trusted networks mean in healthcare, there's a lot of research showing that our trusted networks, the people that have relationships to us, influence our health. And you may remember this cartoon from 2007 is based on Dr. Kostakis' research showing that if our friends become obese, we're more likely to become obese. 171% more likely to become obese if our mutual friend gains weight during a period of time. And I think all of us, we saw that research and we said, maybe we need to go out and find some new friends. But that really wasn't the message. The message was that the people around us influence our health. And if we want to think about how to get people to improve their health, we need to think about it from a social perspective. So what we've done at ShapeUp is we've taken that social approach and we've really worked within employer groups to get employees to form teams. And we got those teams to work together, and then oftentimes they compete to achieve whatever specific objective they have. Increase their exercise, lose weight, maintain their level of exercise, maintain their weight, quit smoking, whatever it might be. And so we published a research study on this, and we wanted to look at how social influence on your team affects your outcome. And here's what we found. Being on a team with higher social influence, meaning the people on your team had a higher social influence on you, increased your weight loss by 32%. And what do we mean by social influence? The level of how well you knew the people on your team, how much you perceived them to have influence on you, the team cohesion dramatically influenced weight loss outcomes. And what we did was we asked people to rate their social influence on a scale of 1 to 10, and we found every point increase in social influence increased the outcomes by 20%, increase your chance of getting to a clinically significant weight by 20%. So I see a lot of platforms and interventions, and I know a lot of people here are launching interventions that dump you into an open social network of strangers that you don't know. And I really think it's imperative that we think about how do we help people connect to people they do know, because those are the individuals that truly influence our health. So how do you do this? One is you can think about rolling out interventions within existing trusted networks. And it doesn't have to be an employer network like we chose to do at ShapeUp, but you heard Zamzi talking about rolling out through schools. You may have heard of the Daniel Plan, Pastor Rick Warren, who rolled out a team-based health improvement program throughout thousands of Bible study groups at the Saddleback Church. Think about how you can roll out your intervention into existing trusted social networks. You'll have much greater impact. If it is a D2C, direct-to-consumer endeavor that doesn't leverage existing networks, connect people through Facebook, help them find others they know that they can leverage to be a part of their initiative. And then what happens is once you have people on a team and they're working together, you can actually increase their social influence. And so we found that team-building activities, ways to let people have discussions among their team, to share their goals with their team, actually increase the social influence and therefore increases the outcomes. Second way to accelerate baby steps using a social approach is to leverage key influencers, right? So it turns out that you can map a social network, and there are people that are central in the network, and there are people that are peripheral. And the people that are central often have more influence. They're highly connected, and their position in the social network gives them that influence. And Malcolm Gladwell would tell us a lot about this, right? The mavens and the other people. So we think about who are these individuals. They're highly connected, highly motivated, and they love to help others, to share information, to police the network. These people are free influencers. They're free engagement tools, and we need to leverage them to get to the people who we really want to adopt the baby steps. We can get these people to do baby steps. It's hard to get the people at the periphery of the network. If we leverage these individuals, we can actually influence the people on the periphery. So here's what it looks like. Here's an example of why it's important to know who's influential within a network. This is a real example from a company called Activate Networks that maps social networks. And they did this for an employer group, and this was a small division of an employer. And they wanted to know who is influential in their organization. So this is their traditional org chart. And I want to point your attention to one person here. His name is Mitchell. And these names have all been changed, but these are real people. Mitchell, you would think, is probably pretty inconsequential in this organization. He sits pretty low. So they looked at and they mapped the email traffic and communications flow in this organization. And guess what they found? Mitchell was at the center of the information flow. And almost nothing went to senior management without going through Mitchell first. And so if that organization wants to create change in their population, whether it's health or otherwise, if they didn't know that Mitchell is the key influencer within that population, they were missing out on the opportunity to help all these other people change and to help reach those people. So we need to figure out how do we reach the Mitchells. And it turns out you can map a social network of an employer. This is a 5,000-person employer and their social network based on email traffic. And what they did was they overlaid body mass index on top of this network. And you can see the yellow are the people that are obese and the green are the people that are healthy weight. And you can see that clusters of the obese individuals, just like in the Framingham study, end up on the periphery. And so what you can do is actually target those individuals by seeing who are the influencers who are connected to them. So you can take your intervention, make it intentional by reaching the people who are highly connected and getting them to pull in the people at the periphery. And what does that do? Well, this is data from the National Business Group on Health on traditional engagement in workplace wellness programs that are solo. And when you look at what happens when you leverage the key influencers to make a program social, you get dramatically higher engagement. So we can get more people taking baby steps and actually influencing the health of the population. So how do you do it? If you can map the network of your population, it can be done through surveys. Who do you communicate with? Who's influential to you? Who do you trust? It can be done through email traffic or other forms of electronic communication. You can overlay the health information on top of that population, and then you can target the key influencers to achieve healthy behavior change. If you can't map the network, and I realize that that's hard to do. I think that's going to happen more in the future than it's happening now. There's something that you can do. You can invite individuals to play a more central role. So I'm astounded at how many platforms treat every user the same. What you want to do is give people the ability to step up and play more of a role, to be a power user, to be a team captain, to be a wellness champion. Those are the individuals who are going to self-identify, and those are the key influencers who will affect the health of the population. The third thing that you can do is to group people by shared goals. And this is pretty intuitive, and we heard a little bit about this earlier, but we looked at what happens if you're on a team with a lot of people that have a shared goal, only some of the people that share your goal, or almost nobody that shares your goal, and it's pretty obvious. More teammates with a shared goal increases weight loss, and setting in discussion of team goals so that people are working together and tracking what they're doing as a group increases weight loss, and six-fold increase in the odds of achieving clinically significant weight loss. So how do you do it? One of the first steps is when you have a user, you have to find out what they want to do. What are their goals? You want to encourage them to reach out to like-minded individuals. You want to actually suggest, because you know everybody's goals, who they should be connecting with. You want to allow team goal setting, not just individual goal setting, but team goal setting. And then you want to show the team's progress toward that goal. That's how you get people working together toward a common goal and increase the outcomes. And the final tool or mechanism I wanted to share is actually not social at all, but I threw it in here because I see so many interventions that don't use this tool, and it's so powerful. And that's simple, personalized feedback. So one example is the Fitbit. I've heard a lot of people talking about the Fitbit. The Fitbit doesn't do this. Let me tell you what this is. What we've decided to do is we took a population of people, and we gave them two interventions. They were both team-based competitions. One intervention simply had progress bars where they could look at their own progress. What was your goal? How are you doing? And the second intervention group got automated messages saying, you're in the red zone, the yellow zone, or the green zone based on your goal and where you're trying to get to. And then it gave them very simple steps. You're in the yellow zone, you're at risk of not meeting your goal. Try parking farther away from the building or taking the stairs instead of the elevator. And what did that do to the outcomes? It doubled the weight loss outcomes. And it tripled the number of people who achieved a clinically significant weight loss. I heard an example of this earlier yesterday, red, yellow, green zones, a really simple way. So many interventions don't do this. If you do it, you'll dramatically increase the outcomes of the baby steps. So those are the 4 baby steps I wanted to share, or 4 ways to accelerate baby steps that I wanted to share with you. They're very simple, but I think if a lot of people went home and looked at their intervention or their approach, you may be missing one of these key insights. And I think if you adopt it, you'll see greater outcomes from your baby steps. Great. And this is how you can reach me.
Thanks, Rajiv. Thank you. David, you're next. Come on up. So, David, I'm going to ask you a few questions as a way to introduce you. Step over to the microphone.
Does this come out of my 12 minutes?
No. I'll have Sarah start in a minute. Step right over here. Let's see. So, Kaiser Permanente Medical Group, Director of Medical Education.
Patient
education, and there's another part
health
of
promotion.
Health promotion. What I know about David, he's been a huge supporter of the conferences my lab has put on. And your attendance at our conference goes back to what?
The beginning.
The beginning, awesome, yeah. And I really like how David looks at human behavior, human nature, and you are the author of 7 books. You probably didn't know that about him. So please welcome and also thank David for being part of this experience. Thank you.
Thank you. Can you switch it? Actually, I'm a practicing primary care physician and work with Kaiser Permanente in Northern California. And my specialty is preventive medicine. And I often say I've been trying to prevent medicine now for over 30 years. And one of the ways I'm trying to prevent medicine is through the recognition that the true primary care provider in the healthcare system are actually people themselves, what they do for themselves and their families. And almost all of our quality indicators and our success depends upon people changing their behavior. And so I'd like to focus today on the challenge that BJ, what's the future of baby steps? And I'm particularly going to talk about what are the direct health benefits of being successful in the first place. So I have to get something out of the way, BJ, I'm sorry. We've gone the whole time, the whole conference is called Baby Steps. I want to ask you, does anybody know what the origin of baby steps is?
What about Bob?
Mother May I. Okay, the Mother May I game that says, Mother May I take a giant step, or Mother May I take a baby step. Then there is Bill Murray and What About Bob, and then there's of course B.J. Fogg, who has popularized baby steps. So at the risk of biting the hand that feeds me, is the baby in baby steps really empowering, inspiring, and engaging? Or do you find it patronizing, condescending, and a little bit insulting? And so earlier today, I learned about how you can do quick user tests. So if you're in the A category, would you raise your hand? If you are in the B category, would you raise your hand? We're going to have to go a little further. So would you prefer baby steps, that's A, or something like simple steps, small steps, tiny steps? If you're A, raise your hand. If you're B, raise your hand. BJ, we have a little bit of data here from some users that I can just tell you as a physician, if I use the term baby steps with patients, it really reinforces the disparity in the power relationship, and I want them to be adult. And so therefore, I think we have to be careful of our language. So the holy grail, I think, of baby steps, I just want to challenge it for a moment to illustrate another pathway. So what if baby steps do not lead to sustained behavior change and ongoing health habits? I think they're really important, but what if they don't? So I'm going to tell you the tale of a donkey. This is about Mullah Nasruddin, a Sufi wise man, joke man, all wrapped up in one. And he was a smuggler, and he used to go across the border all the time smuggling. And every time he got there, the border guards would examine him and take out of his donkey's bags all the straw, everything, burn it, examine it. They could never figure out what he was smuggling. But year after year, he would go across and say, I'm a smuggler, and he was getting richer and richer until he retired. And so one day, after he had retired, one of the border guards came across him and said, all right, can you tell me now, what were you smuggling? And he said, donkeys. So sometimes I'm afraid that the situation we're in, we've so loaded this donkey of simple steps or baby steps with the goal of long-term behavior change that we've missed what is actually maybe what's being smuggled. So let me talk about that. All right, so how does behavior affect health? Well, we've heard again and again, there are the direct effects, and I'm not here to say I want my patients to stop smoking, drugs and alcohol, sleep better, preventive care, and so on. But I just want to focus for a moment. What are the indirect effects of being successful at a small step or a baby step in terms of enhanced mood, and does that affect health outcomes? So I got started in this with a mystery, a study that was done here at Stanford on the arthritis self-management program, where they got lay people together, they worked with other lay people, taught them goal setting, problem solving, and so on, and got improved health outcomes, lower medical utilization. And they thought it works. Health education, you teach people skills, action planning, break it down into small steps. They change their behavior, they get improved health outcomes. The problem was the change in behavior did not predict the improvement of health outcomes. Well, I've had the privilege over the last couple of years to be able to work with Kate Lorig, Hal Holman, and others at Stanford on the development of a program called the Chronic Disease Self-Management Program. Small groups of patients with mixed chronic illness 2.5 hours for 6 weeks. We focus on basic skills, including how to do action planning, set successful goals, and the process is to increase their sense of confidence, self-efficacy, and control. So what did we learn about outcomes? Well, first of all, in randomized clinical trials, we got better health outcomes, changes in behavior, self-efficacy, health status, cost-effective, 5-to-1 to 10-to-1 ROI. Outcomes are long-lasting. Even after 6 weeks, 2 years later, you can get measurable outcomes, and it can be replicated. It's actually an international program now, disseminated actually across the world. What did we learn about the process? What we learned is one of the most important ingredients, the active pharmacological agent, if you will, one of them was people got to help other people. And when they looked around the room, there's this phenomenon called social comparison. They got in these groups and people said, don't put them all in the same group. They're going to depress the hell out of each other. And they look around in the room and they could, things could be a lot worse. I could have what he has, and at least my kidneys are working. And what happens is they get to focus on helping and sharing with other people. And in fact, there's a lot of evidence now that though we measure social support in terms of are you receiving social support, actually a better predictor of mortality and morbidity is are you giving social support. In fact, the helper therapy principle is you can get the most help by helping other people. And so one of the things that happens is people begin to focus not on their disabilities or their limitations, but they focus on their ability, their assets, and their resources. And that builds their confidence. And it turns out that the best predictor of the improvement of health outcome was not the change in behavior, but in fact was their increase of confidence and control. When you went to the people who got better, they said, I felt more confident, I felt more in control. And you go to the people who didn't get better, they say, I feel hopeless, helpless, not in control. It doesn't matter if I change my behavior. Since it was here at Stanford and Al Bandura was at Stanford, it got called self-efficacy. And the other point that we learned from this is bending the trajectory. If you think about life, at some point in your life, due to an injury, accident, illness, or aging, you begin to notice that all domains of your life are not continuously improving. Now, my son used to think, I can run faster, I can solve harder math problems, my next girlfriend will be better than my last girlfriend. We love that feeling of improvement. And what happens with aging, with illness, accident, is you begin to notice it's not improving. What we do in the group is focus on one small thing that people care about and help them be successful so they begin to get that sense of confidence that comes from seeing something improve. So in summary, simple steps can lead to a sustained behavior, and that can improve health outcomes. But I will also argue that simple steps can create a success experience, which boosts confidence, optimism, mood, self-efficacy, and that itself, even if it doesn't lead to long-term behavior change, can improve health outcomes. So let me illustrate this with 3 tales, brief tales: trout, tide, and tires. Okay, so I was seeing a patient. He was overweight, hypertensive, hypercholesterolemic, and had diabetes. His hemoglobin A1C was 10.1. That's not good for his kidneys. It's not good for my quality scores. I tried everything with him: brief negotiation, motivational interviewing, action planning, baby steps, tiny steps, small steps, 10.1. I even tried Jewish mother guilt induction. And that's where I pulled out my quality scores. I said, look, if you won't do it for you, will you do it for me? Help me out here, will you? Nothing was working. Then one day I asked him, what do you really enjoy? And he suddenly smiled and said, trout fishing. I love standing out in the trout stream. I don't care if I catch any fish. In that 30 seconds, many things changed. One is I never saw him as an overweight, hypertensive, diabetic who was pulling down my quality scores. I forevermore saw him as a trout fisherman. Hemoglobin A1C means nothing to him. Trout fishing means everything to him. And we were able to connect between hemoglobin A1C and align it with what he was passionate about. And furthermore, I had just done a quick screening for depression, so it's highly efficient. If he said nothing, I enjoy nothing, finish the screening for depression. And finally, it's a health promotion program for physicians or clinicians. That is, my day is mostly back pain, mucus, vomiting, diarrhea, headache, dizziness, insomnia, and so on. And that's pretty depressing, quite honestly. For a moment, I got to be in a trout stream. For a moment, I got to fix and repair dolls. The second one is discover their solutions. A woman who wanted to take her hypertensive medications, I was about to flood her with suggestions. Instead, I said, sounds like a difficult problem. What do you think you might do to solve it? She said, I got it. I'll put it on the Tide box. How long do you think it would take me to come up with that solution of the Tide box? If you look, this is a big problem. Most of our apps and applications still tell people what to do. Park further away, go get a dog, whatever. Patient-generated solutions, people-generated solutions are not only more likely to work, they boost confidence. And finally, tires. I went in to get my car serviced. The guy walked around my car, he looked at my tires, he came back, he said, you have done a fabulous job of protecting your tires and your rims. Right on. Fabulous. I don't know why that stuck with me. You know, it's not like I'm low ego strength, I need lots of that. But I gotta tell you, he made me feel damn good about protecting my tires. And when you think about it, we so seldom, we focus on all the things people aren't doing. And we focus so little on celebrating their success and really encouraging that. So, if we want to supercharge simple steps, find their passion, discover their solutions, and if they have no solutions, think depression, and celebrate their success. One last comment, and that is, although we're all focused on successful steps, building confidence, and so on, I think it's also interesting in the future to consider the benefits of failure. And that is, what might happen that, can it increase motivation? Can it increase skill level and chances of future success? And also, when might failure actually be cognitively reframed in order to further encourage achievement, celebration of future successes? And with that, I thank you.
Thanks, David. We'll have a chance to discuss and ask questions in a little bit. Next, Tim Chang, who is a managing director of the Mayfield Fund. Tim did his MBA here at Stanford, so I had to do the Stanford Connect thing. You have some impressive awards, investments, board memberships. I won't go into that. Impressive guy. I'm going to talk about some aspects of gamification. Take it away, Tim.
Sounds good. Thank you very much. Good afternoon, folks. I'm Tim Chang, a managing director of the Mayfield Fund. We're an early-stage venture capital firm based just down the road in Sand Hill, investing in all areas of technology, big data, cloud. My particular superpowers are in mobile, games, and gamification. Spend a lot of time in quantified self, also in all aspects of consumer internet, digital media, social media, and also invest in these same themes in China. Some companies I've invested in the past that I picked up some of these lessons from, which I'll share with you today, include companies like Playdom, one of the early companies in social gaming, and Gmoko, similarly, a company in mobile gaming. And then I kind of took that theme to more sort of non-traditional games areas like healthy gaming. So a company called Lumos Labs, which is the leader in brain training games, believe it or not. 250,000 people paying $15 a month for online and mobile brain training games. Okay, that's pretty interesting, something to check out. A lot of lessons learned from how they converted this freemium model, free basic to premium subscriptions. Then I co-founded a company and led their funding in a company called Basis. Check out mybasis.com, but it's sort of a Fitbit killer, sort of the world's first clinically accurate heart rate monitor, and just a wristwatch that's cloud connected. And the data you can do there is really interesting. One of my favorite demos is overlaying your actual heart rate signal with your Outlook calendar and showing who and what stresses you out the most each day. And then I invested in a company called HealthTap, which is a pretty cool mobile app. So I wanted to share with you sort of the notion of gamification and quantified self as a framework for how you can fit baby steps in and how gamification can take you from baby steps even to giant leaps down the road. So something you should know about me, I am a classic geek. I grew up with a lot of polyhedral dice and board games like Dungeons and Dragons back in the day, and continued playing and programming computer games when all those role-playing games got computerized. I've sunk hundreds, if not thousands of hours into meticulously designing virtual characters and career paths of these players in various video games over the last 30 years. And it dawned on me like 7 years ago, if I spent all this time carefully crafting, Eldred the orc, up 82 levels and planning out what achievements and skill sets he has and all these things, how come I don't treat my real life that way? How come I don't plan my real life like a role-playing game, if you will? And if I did, what would that look like? And then I had the realization that life kind of is like a game. So if you go back to first steps, what are the elements of a game? All right, a game has a goal, an objective, and note that these goals or objectives can be set by the system or user-defined goals. Second, a game has a score that's given to you in real time and explicit feedback after every decision or action that you make. Take the green door, +2 points. Jump over this platform, +3 points. Get killed by the barrel, -5 points. Start over. It's explicit and it's real time. And with the score comes rules on how you influence the score, plus boundary lines for how to play. What is the sandbox? Where can you go? What can you do? What can't you do? Okay. Then if you take that and apply it to the real world around you, then I would challenge each of you to think, how is the following like or not like a game? And I would say each of these is a game, just implicitly. Dating, finding a mate. Your income taxes are definitely a classic game I think a lot of people play. Landing a job, buying a home. Fundraising for your startup is definitely a big social game. And my favorite of all, Facebook and Twitter, social media itself is an implicit game. How many folks here tend to update Facebook or Twitter on at least a daily basis? Probably most folks. So let me ask you this. What are you looking for from that? I would argue that these are all a game, and the score is the number of likes, retweets, follows, comments you get. The only failed Facebook status or tweet is one that gets no attention, and that's the game we're playing for. Note when you post something, immediately within a few minutes, you're checking back to see, anybody notice? Anybody notice? Anybody write? Anybody comment? And I will argue that this is also around personal brand engineering, because in social media that is public, we'll talk about this in a bit, public versus private play, you never tweet things like, feel like killing myself, going to the therapist. You only tweet that which you want people to see you as. So it's always private table service in the Bellagio, bitches. It's always that kind of thing, right? So with that, I want to talk to you about what sort of elements make up gamification. There's this great term, gamification, game mechanics. Everybody likes to talk about it, and entrepreneurs stick it on their pitches. But what is it? So this is a framework, an overview of the vectors of game mechanics you can use. First of all, gamification is a toolkit. It's a design framework to think about, not sort of a bolt-on or panacea for an otherwise crappy or unengaging experience or inferior product, all right? So if you think about it that way, within it, there's both single player and multiplayer or social gameplay mechanics. So for single player, this might be just you playing against yourself. There's achievements you're trying to get. There's a leveling that you're trying to go up. There's quests you're undertaking. There's collections you're trying to complete. And the scoring is for the most part private. It's for you. It's you against you, trying to do better, trying to do more, trying to sort of beat your own record. Then multiplayer gamification gets really complicated, and this is where I talk about using the 7 deadly sins as a design framework and motivator, because once you're dealing with multiplayer, you're talking about public scores and comparisons, and then there's also collaborative gameplay mechanics and competitive. This is very interesting because each of us has different personas and types of plays that we like. I'll give you an example. Young males, age 16 through 25, tend to index highly on the deadly sin of wrath. They love to pwn each other and make fun of each other for it. And so that motivator there is one of kind of like a competitive play. That is not the same in general for female users who actually are more around affinity, self-discovery, and collaborative play. So if you were to shoehorn all players in the same bucket, it doesn't always work because different personalities like to play in different ways. So think about different ways of gamifying an experience for different persona types. Second, there's explicit and implicit gamification. My favorite example here are stats versus leaderboards. Leaderboards show a forced rank, and there's definite leaders, and you see exactly where you fall in the pecking order, whether you're number 1,038 or number 2. And there's a problem with leaderboards that is a forced comparison, so you always know where you stick in the rank. Let me compare that with using stats. If I were to give you a dashboard of your stats, like number of calories eaten today, or number of friends that are following you or you're following, you'll do implicit comparison, even though it's not explicitly ranking you on a leaderboard. And there's something powerful about that. If I were to give you sort of a page of different stats of things you do or you care about through your day, you'll probably pick one or two of those things naturally that you're kind of interested in, and you'll sort of start to gamify it yourself, especially when you see other people's stats. So it is something that we like to think about there. Private versus public gamification. If it's private scoring, it's something, again, back to single player, and it's something you might not want to share versus sort of public, right? I would say Facebook and Twitter are very much public, sort of social media gamification, whereas something I learned from Lumos Labs, they give you a brain performance index score. That's something that's very private to you, and there's many, many, many players there not comfortable sharing that. Because that score can go up and down each day, it's actually more for themselves on a journey of self-discovery, kind of self-enrichment, and the last thing they want to do is post that score. So there's something interesting that we've learned about leaderboards and scoring. Leaderboards tend to appeal to the top 5% of players who are doing the best, because if you're doing really well, you want to compete and you want to show it off. Actually has a negative effect of scaring off new players. Because if you look at these leaderboards and you see, my God, these people have 800 million points, I'm never going to get there. You're just not even going to engage, right? And so there's something to think about there on the pros and cons of each of these gamification mechanics. Second, behavior by identity type. There's actually 3 types of identity traits that we can take. First is anonymous. Anonymous play leads to some really interesting and unintended consequences. There's no cost to post anything, including tormenting other people. I would basically say go to YouTube and read the comments there, and you'll pretty much weep for the future of humanity. Communities like Formspring that were all based on anonymity, they thought it was getting honest opinions. What it led to was a ton of cyberbullying. Right, so anonymous can lead to sort of costless or no reputation risk there. Second, authentic identity play. This is Facebook. You have a real identity and you're very careful about it. This can also lead to unintended consequences because it's your authentic ID. You care a whole lot about your reputation, but because it's public, you actually over-engineer it for the you that you want people to see you as, not the actual you. So I would argue that sometimes these authentic IDs tied to one ID of yours that's publicly known feeds aspirational identity and not actual authentic identity. Think about that in terms of health applications, right? You might only post the wins you have, but you kind of don't want to share the losses or things that you're not so proud of. What I'm actually super interested in is the next wave, or sorry for the typo here, but I call it pseudonymous behavior. This is more like things you see on Xbox Live where you have a gamer tag or a screen name, or Reddit, or communities like Fark.com. You do have an identity. It's not necessarily tied to your authentic identity, but it's one you invest in the reputation of. But it's something you can be a little more freewheeling on sometimes because it's not tied to your authentic identity. So you can share things like, hey, I feel like killing myself, or I'm not so happy today. But you can be more authentic because you don't have the authentic ID risk. And this works well in vertical communities where you're trying to meet others that have the same interests as you, but aren't in your actual authentic social graph. So the other thing I would say is where I think about baby steps, the term I like to use is starter steps. And then I feed that into gamification by the user life cycle. There's a few phases users go through. And I think of leveling curve design. In games, there's always levels. And the whole point of levels is that for new users, you give them starter steps, and levels 0 through 10 are always your tutorial. That's where you're teaching people what to do, showing them how to use the system, and what you're trying to do is incite this little Pavlovian response for them. The rewards, do this, get that, do this, get that. You want to trigger that addictiveness, because I would argue that baby steps plus sort of the crack, that sort of like addictiveness of the rewards tied to actions is what leads to giant steps down the road. A good leveling curve design means that within like 10 seconds you go from level 0 to 1, then the next 30 seconds you go from level 1 to 2, and then progressively asymptotically gets harder. By the time people are at level 20, you can get them to jump through all sorts of hoops for you because they're well trained on that Pavlovian response curve and the rewards that they want. Once users are engaged, you get users to grind through levels 10 through 90. That's sort of the mid state. And then once users are power users, you're trying to think of how to retain the power users and then convert them to target actions you want. This is the art of the so-called freemium model, free basic play, but then premium things you go throughout. And then you layer this iterative give or get dynamic throughout the experience. What you're really after is users to give you either money or data. And so that is how you're trying to always, if you give something to them, then you ask for them to provide you something, so you get something back. So you're always giving and getting, explicit value exchange and little baby steps there. How this ties to quantified self, I'm running short on time here, but I've got 3 key points for you. Quantified self, this big trend we're all talking about today, but I really worry it's a bunch of really healthy geeks bragging about how healthy we are to each other. So I really want this to go to the mainstream, and to do that, we need to make the measurement of quantified self seamless. The measurement and tracking cannot require upfront behavior change. It has to be low friction, especially because users are less motivated upfront. You want continuous tracking and always balancing accurate versus good enough. You have to make the scoring of this all interactive. My key point, if I could leave you with one thing, give people insights, red, yellow, green, not data. People do not give a shit about data. They care about how am I doing and what should I do better, and just tell me 2 or 3 things I should do next. And lastly, through gamification, you make it fun. You leverage these multiple dimensions of gamification we talked about, and with that, I think you'll allow people to play by their personality types, and you'll get them started with the baby steps, get them addicted and trained with these Pavlovian mechanics, and pretty soon they'll be doing giant steps over time. Thank you very much.
Very good. I've got a bunch of questions for you all. Before I get to the questions, I want to call out and thank a few people who we haven't yet thanked. You notice the balloons keep changing. Please thank Dennis Bills for his ongoing support. Dennis, staying out and away. There we go. The technical people have been awesome. You've just been right there with everything, the music, the slides, everything. Thank you, tech team. Thank you very much. And I think we applauded the volunteers. When you see the host badge, as you go, do thank them. They've taken time off of work and what have you, classes to be here. We couldn't do it without those volunteers. Let's get to the questions. First question, I know how it is sometimes when you speak and you sit down and think, man, I wish I would have said X. Let's go back. Hemi, is there something that you wish you would have said that you didn't get out in your talk? No. Rajiv? You guys are good, man. I always have something. David?
Small steps or starter steps like that is my least favorite way of changing. It's a last resort as far as I'm concerned. Personally, I prefer environmental change, what you called epiphany or breakthrough change or quantum change. So somebody falls in love or they hit bottom.
You prefer that?
Well, I like that notion that they don't sit down and map everything out and measure everything and set goals and so on. And I like pleasurable change where people change just because it's intrinsically rewarding, they enjoy it, and again, they don't have to. When those things don't work, hey.
Baby steps.
Baby
Always
steps.
there. Interesting. Tim, anything you want to add?
Yeah, I guess I would say I think the rewards and motivators should always be keyed to 7 deadly sins if you can. And I know it's a bit controversial. Some people always say Maslow's hierarchy of needs, but I can probably decode any young person's behavior under 35 through 1 or more of the 7 deadly sins. So I think if you don't tie that in as a key emotional trigger, your service will not be addictive.
Okay. How to think about stuff. Ways of thinking, I think, is very practical. And so we've heard some of that today, and interesting. Let me ask a question, and it applies maybe mostly to 2 of you, but all of you can chime in. So operant conditioning, reinforcements, punishments, and so on. How does celebration differ from that, if any? How does game mechanics? Isn't it just simply operant conditioning with a different label? I'm actually asking a little bit of a provocative question. Thoughts?
Yeah, I think it is. And maybe just gamification is just a easier to swallow packaging of the concept for people, because games sound like a fun concept.
Yeah.
But there is one thing I wrestle with, though. One of the key tenets of game design, you only use carrots, not sticks. And I'm not actually sure that applies to outside of the game world, because sticks can be pretty powerful too. But there's a user psychology issue that you have to think about.
Celebrate that concept?
Yeah, I think it very much follows that. I think the only reservation, and I think I partly got this from you, BJ, is you floss one tooth, and that's usually where people forget it's the yes victory after that that is very powerful, because that yes victory is what actually changes your mood, your confidence, and your willingness to do more. And so I've just chosen to pump that up.
Awesome. Other comments? I mean, what you're talking about, are we going back to Skinner?
No, I think with operant conditioning, the key is how do you get people to willingly submit themselves to that, and the key is who's doing the operant conditioning. So, what I talked about is if you take a social approach, people are willing to submit themselves to their friends, their family, their colleagues, and let those people condition their behaviors and give them the feedback, versus they might not come to you, BJ, and say, train me to do this. I'm willing to submit myself to you. So I think it depends who's doing the operant conditioning, and we can affect that.
Point of view on that? I concur. Okay. Well, okay. As we look ahead to baby steps, or whatever we call, I love different points of view. And one of the things that I hope my students understand from me and people I work with is I have a strong, clear point of view, but I'm always in learning mode and ready to shift when I'm wrong, or there's some other better way to talk about it, think about it, or even refer to it. So hopefully nothing, and it's kind of troublesome that we're recording this and people are tweeting it, and a lot of things get etched in stone. And a lot of my talks, I do not let people record it, because I want to be able to say stuff, and not 10 years from now, 20 years from now, people go, oh, once upon a time you said this. And it's like, well, I'm hopefully smarter now. In terms of, you've had a lot of uptake and a lot of use, and you've built a system. However, the FDA, for example, is not using your system. As you look ahead to the future of the resource you've created and the uses of it, what is stopping it in the future from being more widely used?
Distribution is a big challenge for internet and mobile services. So that's something we struggle with every day. Everybody thinks of the outliers like Instagram, but not everything is inherently viral. Not everything is, in retrospect, everything is simple, but it's always hard when you're in the middle. So, what I see apps like Fooducate doing is, in some way, supplanting the role of the regulator in various industries. I think the FDA should have done what Fooducate is doing in protecting consumers. It's not doing its job well enough because of various economic and political reasons. And I think services like Fooducate and many others can potentially create the grassroots type of upheaval in big systems, political and economic ones. And that's my hope for us and for others.
Let's talk about a different way of distribution. It's through employers. And this is something like I said yesterday, 10 years ago, I was completely blind to this distribution system through big companies and their efforts to keep their workforce healthy. Rajiv, what advice do you have for innovators here who aren't tapped into that? What should they understand about that system and distributing through that? It's already set up, right?
Yeah, I think the one caution is once you go in that direction, it's really hard to shift away from it. So it's very hard to innovate and be a consumer application and also be an application that you can sell into a business environment, because the requirements and the needs are so different. So somebody asked me the other day, we resell through Aetna and United, and they said, did you have to go through a business associate agreement? And the answer is yes, we did. And so, all of our employees have to get drug tested, and they all have to go through background checks, and we have to be audited from a HIPAA compliance standpoint. And if you want to be a consumer application that's nimble and can do whatever you want, like Mark Zuckerberg does, where you decide you're going to make a change and you roll it out to everybody, that's not possible in the B2B environment. So I think you have to really decide if that's the direction you're going to go in. Are you going to service large populations of people through businesses, through health plans, or are you going to go direct to consumer? And it's hard to do both. You really have to pick one or the other. So,
Okay. Am I correct to say direct to consumer on the edges is more your specialty and health plans and wellness? Yeah. What's the key of working? So somebody says, got this thing, Kaiser's big, Kaiser has a lot, they're act together in a big way. We want to work with Kaiser. How do they do that? Is that a good question?
Call me. No. Please, don't tweet that. I'm sorry. First of all, there are so many phrases that get repeated over and over, like fail fast and so on. And one that hasn't come up, but I think is important, is under promise, over deliver. And there is so much magical thinking on the part of employers, on the part of people who develop programs and applications. So much magical thinking, and it gets built into the business case. Here's all the return that you're going to get and so on. And at the end of the day, I still think that employers are going to come around to looking for real value and would be like to be delighted and surprised by things that actually work and people who are committed, not just because of the business plan, but because of their mission, committed to find out what works. So the hardest problem I have is the 10,000 proposals that come in that are going to save all of Kaiser Permanente's members and keep them healthy and so on, and really sorting through that to the ones that have real value. And it does also come back to the people. And I'll just tell you a quick anecdote. Everybody usually comes in when they approach Kaiser and they figure 9 million members. Let's see. If we could just get such and so, and the millions of dollars start floating up. And it turns out that the most successful partners we have, and Christine can answer this as well, are the people who are really willing to do pilots and really demonstrate value and patience. It's a big organization, it's complex. And the people who are really impatient in terms of that relationship and don't establish relationship and trust, it usually doesn't work out.
What's the starter step down that path? Pilot on their own or with you?
I think generally you have to have a little bit of testing,
Have something.
You have to have, there has to be a there, honestly, and then willingness to pilot and iterate. And I don't know, Christine, do you want to say anything on that? Okay.
Yeah, great.
Good.
Rajiv, you've been in the world of the employers. What's the starter step in that direction?
I think it's evidence. So, when you say there has to be a little something there has to be pretty clear evidence, and it has to be something that's not you putting forth your data and saying this is great, but actually some third-party validation.
Yeah.
If you think about the idea of crossing the chasm, what gets the early majority to start adopting solutions that the innovators adopted? It's what their peers are doing. So to get the early adopters, you have to show some level of evidence. To get their peers, that starts to build on each other. And so you have to really have a list of, these are the clients we're working with, even if they're pilots. And somebody talked about this earlier yesterday. To call on a company and say, hey, we're working with your competitor, suddenly you get their interest, and they're much more willing to listen to what you have to say. So
That works with VCs too.
Yeah, I was going to, Tim, so you're in a position where you're making investments in these kinds of things. What's the starter step with you?
What I always look for is, does it delight the end user? And what I mean by that is that there might be a goal, like you're trying to do good or be healthier or something, but people they kind of care about that, but they want to know the immediate payoff. And again, it's kind of back to these 7 deadly sins, but there's a big parallel with the education market. A lot of education solutions fail because they're trying to educate, but if the kids don't love it and scream about it and bug their parents for it, like a Club Penguin, it never gets adopted. Yeah. So even if a parent pushes it, a school pushes it, an employer pushes it, if the end user's not delighted by it, then it's not going to stick.
Nice. Questions from the audience? I'll come back. So if you have a question, stand up so I can see you easily. Hemi, in the world of apps, what is the unexpected, so as people look forward, there are people in the audience who are either doing apps or plan to do apps. What should they be watching for in the future? Either the unexpected opportunity or roadblock?
Wow, that's a big question.
Yeah. We're at the end, so we're doing big, big things.
I have a few thoughts about apps. I think there's this big, a lot of people ask me, should I invest in an app? A lot of organizations think that apps, they have to have an app out there. And I don't think there's an ROI for lots of groups in creating apps. I would suggest create a mobile optimized website first before you do an app. Because it's almost impossible to get discovered on the App Store with the numbers going on there. Yeah. People are also talking about the disappearance of apps in the future and everything will be HTML5. I can't comment on that. I don't know yet.
Okay, great. I think you've heard a lot of good wisdom today. Question back here.
Yeah, I have a question about really oversimplifying information or when you have conflicting information. For instance, I just went to Fooducate to check out your site, and I saw that almonds received the score of an A and a big green button. Yet our speaker this morning from Weight Watchers said that he needs to tell the flight attendant not to bring the almonds by his chair, and because he sees them as being bad because they're high in calories. So on the one hand, I think failing fast is good from an IT perspective and getting your ideas out, but I don't think we necessarily want to fail fast when we're giving health advice to people. And I'm wondering, how you all are dealing with the idea that maybe we're giving the wrong information to people, or maybe we're giving the right information to 75% of the people, but the wrong information to 25%. And how are you dealing with that?
Let me ask Dr. Sobel to address that. Is that okay?
Yeah. Well, we're pretty dumb. And, but that's not the image of medical science and so on that gets publicly disseminated. And by that I mean is we're caring and we're doing the best we can with the available information we have. But so many of the things that we end up recommending, we try to practice evidence-based medicine, but the public needs to understand that that evidence, fortunately, is continuing to shift and evolve. And so at some level, we try to at least do no harm with that and not raise undue anxiety. But I salute the efforts like Fooducate, which are at least putting a stake in the ground and saying, look, some things are probably better than other things. And of course, with the almonds, it's a matter of quantity as it would be with any of the foods. But I just think we have to be honest, and it's the same thing as not to under-promise and over-deliver, but people need to understand that it's an imperfect science, and as we've heard earlier, not a very agile science yet that we're working on.
But we might be getting there. I heard a lot of buzz around that. Yes, right here, question.
Hi, my name's Jazz, and I'm actually a gastroenterology fellow here at Stanford. And one thing that sort of resonated with me was when, Rajiv, you talked about influencers. And sort of, we've been talking a lot about social networks, but one thing I sort of wanted you guys to comment on is whether you guys have sort of used physicians as part of those influencers and sort of bringing them into this picture. Because as a physician, I've never recommended an app ever to one of my patients. And I was wondering also, like from Tim's perspective, if you have a physician actually, on board and being one of those influencers, how does that sort of, have you guys sort of went and delved into that for in each of your respective fields? Okay,
let me do this. So as we approach the end, I do want to end on time, or very nearly so. You have one breath to answer the questions, and if you don't have a strong opinion, we'll go on to another question.
So we know that physicians are hugely influential, especially in the weight loss area. So when a physician recommends weight loss to their patient, they're more than twice as likely to actually go out and try to lose weight. So we've done programs where we've recruited networks of doctors to prescribe our intervention to their patients. And we get really high uptake. In Rhode Island, we have 250 primary care physicians that are prescribing our program to their patients. And they start with good intentions and they do it for a few weeks, and then because there's no reimbursement tied to it, and because it gets crowded out by so many other things doctors are trying to do, they fall off, and then a month later, nobody's getting sent to our program through physicians. So I think we need to solve the financial incentives, the carrots, to get the physicians to actually keep, to do that and to play that role. But when they do, it's very effective.
Are there strong points of view here? Tim?
One breath? Okay.
Yeah.
So that's the whole premise of my investment thesis in Health Tap. You got to try the app. I'd be curious to see what the doctors out there think. But essentially, doctors' answers to consumer questions vastly outweighs what they think of other consumers' answers to those questions. The trust factor is through the roof. But one other last thing I'll note is when doctors like or agree with other doctors' answers, that credibility also shoots up. And there's reputational rewards for doctors answering questions that way.
Interesting. Question over here.
So this is a broad question, but you mentioned it's an open field. I'm Joseph Williams. I'm from UC Berkeley. I do cognitive science, and I'm interested in connecting it to health and education applications. So there's been so much content covered here, and tons of great ideas, but working memory is about 3 or 4 concepts. And at any given point in time, how do people apply all this knowledge? So I kind of wonder if there's an issue in behavior change now where the problem is not lack of knowledge or ignorance, but so much as being able to apply it to the right moment. I guess this is kind of the issue raised by Atul Gawande in the Checklist Manifesto. So what do you think would be your bet for the best resource for learning about what is already known about behavior change? Whether it's a book, whether it's a website, whether it's something, some other kind of interactive thing that could, it's one place you can send people to where they can then say, are you a user? Are you a designer? Are you looking at this kind of problem with that? Because it's a hard problem, it's a broad question, but the truth is every time someone tries to change a behavior, they answer this question. They probably don't answer it as well as you guys could.
What's the best resource for learning about behavior change? Me. Okay. Well, curious, what would you say?
If you haven't read a book by Robert Cialdini, it was mentioned earlier, Cialdini, I would start there. It's on social. It's called Influence, and it's Principles of Social Influence. But you just, I think you've just created a great business idea. So that sounds like there's a problem, and the problem is where do people go to get high quality information about behavioral science as applied to health? And I can point to about 10 different sources. But maybe there's an aggregator of those sources or a possibility of an aggregator in your question.
Yeah. The Cialdini book is a wonderful book, but please do not stop there. There are more than 6 influence principles, and just knowing the principles doesn't tell you what behavior you should be targeting. So it's a great starter. If you haven't read it, you absolutely should read it, but too many people stop there. It is just the appetizer to what should be a lifelong. Yeah. Any other suggestions on that?
I'm a big fan of Predictably Irrational by Dan Ariely. It's almost like a pricing guide, by the way, for microtransactions.
Yeah, good question. Any other questions before we, let me start with this idea, which I think is absolutely right, and it's not my idea, it's Mae Jameson, and I was driving along right within 200 yards from here, probably 15 years ago when I heard this. And she said, social sciences are harder than the physical sciences. And I was like, oh, finally someone's saying it. And she went on to explain why. And yeah, the people out at SLAC and the nuclear physicists and whatever get all the credit, but what we're doing essentially as social scientists trying to change behavior is far harder than the physical sciences. So we just, let's just recognize that. Be cautious about what has been the received wisdom about how behavior works. Not all of it's correct, and even if some of it is correct, it may not be applicable to real-world design. So be a skeptical consumer of whatever you might read. We're still discovering stuff, and we have new tools and ways of understanding and discovering how behavior works. It was a surprise to me as a graduate student to finally realize how little was really known about how behavior works, and so feel free to question the received wisdom. I do think we should be exploring behavior in our own lives to develop our intuition. You know, how do you get yourself to do something really hard? How do you create habits? How do you break habits? And so on. There are patterns, and it's not random. There are patterns to all of this, and there's a lot yet to be discovered. And my hope for us as, in some ways, a loosely connected community is that we'll be able to call out those patterns and share them, and especially share what works in the real world. I've been really, really happy with the energy of people in the breaks and at lunch, and even when I couldn't quiet you down because you were talking, that's a bit of a success disaster, and that's great. But eventually you quieted. But it's really, in a lot of ways, is having you connect with each other. I do believe that at this conference we had all the right pieces, all the right players and organizations to make a huge impact in the world. We just have to figure out how to find the right people, the right projects, the right way to get them together, and the right way to get them into the world. And that's pretty hard, I think. Thank you all for being part of this. Thank you for coming. Thank you for sticking with us 2 days. I really do appreciate the speakers and the people who didn't speak on the program as well. I've heard a whole bunch of good feedback about what's happened like outside and in the hallways and all of that. It is hard to put together a conference like this. We have 40 some odd speakers and a whole bunch of stuff behind the scenes that you haven't seen, but it is very rewarding. I feel like we all are in a very fortunate position. You know, whether you're at Stanford or somewhere else, or whether you're in a startup or a big company with a stable job, all of us in this room are in a very fortunate position. So I feel like we also have the obligation to try to solve these really hard problems. And part of that is understanding how behavior works, and part of it's other things, like how do we distribute it, and how do we get, you know, engineers to cooperate, and so on. Share back what's working for you, and we look forward to seeing you next year. Thank you, everybody. Thank you. Thank you. Thank you, Hemi.